I'm excited that we are here where we are today, and I believe it's a start of something that is really very beautiful for the continent of Africa. TAConnect has just hosted a panel session on the use of human resources for health at the primary health centers, how to optimize it. And at that session, we had people from the government, the ESs of both Kaduna and Gombe states, and the Director of Health System Strengthening from the National Primary Healthcare Development Agency, and a representative from DGI talk about some of the work and interventions that TAConnect has midwifed.
Over a 2-year period, working in Kaduna State, very closely with the Kaduna State Primary Care Board, interventions led by them using their own staff, their own resources across all of these 255 facilities. So over that 18 months, what we found was about a 50% reduction in unapproved absenteeism.
We have provided guidance for the state that 5%, the best 5% of the staff, both at the facility level, that is at the PhD facilities, and also the community-based health workers working in the community, will receive an incentive.
Kaduna State lately has recorded a number of measurable, very, very important achievements in human resources component of PHC service delivery, and largely they are attributable to some of the interventions offered by TAConnect and partners.
For productivity, it's something we are working on right now. We have piloted in a facility whereby these cadres are segregated, and of course looking at the services being provided, especially in facilities that are centers that provide mostly all the services apart from preventive services. They also delivery and then some minor ailments.
In all that we do, in all our policies, we must ensure that there is political backing. We must ensure that the people that have interest and influence in whatever policy we are putting in place are informed, are carried along, and are allowed to be part of this implementation.
What stood out for me most in that session was how really focusing on transforming the basics in primary healthcare facilities can make a massive difference.
I think the lessons from Gombe, it's something that it's very, very important. Looking at how they've been able to succeed in eliminating ghost workers among the health workforce in the state using the biometric system.
It was really heartwarming to hear all the progress that they've made and the innovations that they have put in place to enhance their human resources for health.
What basically stood out for me during the breakout session on human resources for health is the fact that in Nigeria, we are beginning to make progress.